The good thing about here is I had pictures to show you guys, but apparently, it was not the right venue, so I'll make them available later on. But today brought a lot of emotions. Being here 15 years later, for me, I graduated in 2002. It's already been 15 years, and also hearing from the variety and the backgrounds of all the speakers today. Like, we went to China, we went to Ottawa, and so it's interesting. And we've touched upon poverty and gender issues, and these are all actually things that we're actually seeing from a homeless perspective. So, like you've introduced me, I'm a neuropsychologist by training. I exclusively work with individuals who are homeless in the city of Toronto, and I also work with people with severe mental illness at CAMH. So today, it's kind of odd because we're putting in a homelessness. It doesn't quite fit with that last topic, but I think it touches upon many topics we've touched upon today. So the title that I introduced today was Homelessness in Canada, More Than Meets the Eye, and I'll explain what I mean by that. So why do people become homeless? I think that's a very large topic. It's very different for different people. We've talked about women and children being homeless, and driving force behind that oftentimes is family violence. There's also the issue of poverty in Canada. So since the 80s, we've seen a disinvestment in social housing and so on, and the demographics change. There's a lot of change that happened in the past 30 years that's affected the situation in Canada now. One of the topics I'll talk about more precisely now is not necessarily homelessness as a whole. There are about 200,000 people in Canada that experience homelessness, and usually through shelters and so on any given year. I'll focus on something more narrow, which is what we refer to as chronic homelessness or episodic homelessness. It affects about 10 to 15,000 people in Canada every year, but it's the impact of this smaller group that has on society that I want to focus on today. It's costly to society. Homelessness is costly as a whole. I think when you start to think about hospital costs, jail costs, shelter costs, supportive housing costs, and you add all that together, it represents millions, hundreds of millions of dollars of investment to try to provide care and services to a population that is very, very complex. Homelessness actually costs Canada's economy $7 billion a year, and there's a lot of figures that factor into this, but one example I want to bring forth is at CAMH, which I assume most people know what CAMH is. It's the largest psychiatric hospital in Canada. We have an ER. We have an emergency department there. About 10,000 people visited CAMH ER last year, so it serves a lot of people in the city of Toronto, usually psychosis and a lot of mental health issues. What was odd to me when we start digging in who actually visits the shelter, 10% roughly of ER visits last year were due to people being homeless. So when you think about it, Toronto has millions of people in it, and 10,000 people visit CAMH, but yet 1,000 people, 10%, and when you think about homelessness and people use shelter, we're talking about 4,000 or 5,000 people in this city. So homeless people are very much overrepresented in our ERs, and it costs us about $2,700 per ER visit. So if you do the math, and CAMH alone, and there's a lot of hospitals and a lot of ERs in the city, CAMH alone spends about $2.5 million to $3 million a year on just putting Band-Aids on people who are homeless. They come in, we try to stabilize them, we discharge. Sometimes people are so unwell, they end up coming into our inpatient services. And one of the subgroups I'm going to talk about today is those with developmental disabilities, or what we refer to as dual diagnosis. It can cost up to $3,100 a day to provide housing and supports to somebody who's homeless with a dual diagnosis. That's over $1 million per year if you do the math again for one single patient, because oftentimes there's a lot of medical needs, behavioral needs, and requiring a 3-to-1 staff ratio, psychiatrists, psychologists, social workers. When you add it up, the costs are astronomical. And even shelter systems. So we have emergency shelters in the city. I work in one of them. I work in many of them, but primarily in Seton House, which is one of the largest shelters in Canada, men's shelters. And it costs us thousands and thousands of dollars per person per year to actually operate a shelter in the city. So costs are astronomical, and we're not doing anything significant. And again, we're putting Band-Aids on a situation that requires a lot more. We've talked about housing, and access to just affordable housing in the city of Toronto is limited, challenging at best. And when you start looking at the question of those on disabilities requiring housing. So in Ontario, we have something called ODSP. So it's basically how, if you're on disability, you get some financial supports through ODSP. It's about $1,000 a month. So when you think about most apartments in the cities now cost about $1,500 or more per month, there's a big discrepancy. So what we're trying to do is provide some housing supplements and so on. So just the issue of poverty alone, so people who are just not making a lot of money have difficulty finding housing. And so imagine now if you have a disability overlaid with that and you're homeless, we're not providing a lot of opportunities to exit homelessness, and that layer of poverty is pervasive. That being said, poverty is not the only thing. So when I said more than meets the eye, a lot of folks, and I'm going to show you some, I would love to show you some actual pie charts and figures, but I'll describe them in words, that there is more to homelessness than simple poverty. One example is in 2014, we did a program evaluation of all the persons coming to our clinic at Inner City Family Health Team. That family health team is dedicated to homeless individuals in the city, and it's the only family health team in the province designated as a mental health and addiction primary care family health team. When we broke down the stats of all the people that visited neuropsych service that year, 53% actually had an alcohol dependency or alcohol disorder. So that's a big chunk of people. Only 26% of the folks visiting our clinic did not use any form of drugs or alcohol. So that's a big problem. Addictions is a huge problem with the homeless, for folks who are homeless. On the flip side, when we look at other mental health and addiction, mood and anxiety was overrepresented. Again, 56% of folks who visited our shelter or clinics had a diagnosable mood and anxiety problem. Psychotic disorder, 19%. And the other thing that I want to talk about is neurological issues. Traumatic brain injuries with loss of consciousness. Over 50% of the population we work with have a traumatic brain injury. That means a blow to the head that affects neurological functioning. And then you'd add stroke to that. Dementia is about 20%. So these are big numbers. There was a blip on our radars, however, that we did not anticipate. And we assumed that sectors would have taken care of that subpopulation, as it's the one of neurodevelopmental disorders or developmental disabilities. We assumed schools would be a good safety mechanisms to prevent kids with developmental disabilities from ending up homeless. And then in here we can consider things like autism, Fragile X syndrome, severe traumatic and brain injuries in childhood, and so on. And this was both a surprise that was very negative in the sense that we didn't anticipate it and we all felt horrible, but because this is the first time we actually look at the question, it's like, how is this even possible? On the flip side, it presented as an opportunity, because here in Ontario, we have something called Developmental Service Ontario. It's a $2.2 billion program annually that is there to help individuals with developmental disabilities not accessed by persons who are homeless currently. There is no data available, and when we did a survey, nobody even knew it existed in a shelter system. So what we did then, so developmental disability is really a condition that requires a psychologist to diagnose it. It's really something that happens pre-18, so something in your development affected your brain functioning in such a way that affected your cognitive abilities. Your IQ is very low, so you're below the second percentile of intellectual functioning, and it also has adaptive functioning deficits. Self-care, managing finances, reading, writing, academic skills are all affected in such an extent that functioning is made difficult. So imagine now somebody with autism or somebody with another form of developmental disability being in a shelter system, which is a very chaotic environment. People are left to their own devices. These individuals are very vulnerable. We have subgroups of people with developmental. Now there's even a task force on human trafficking and sex trade, because young women with developmental disabilities are actually being taken advantage of in the shelter system. And it's a subgroup that was never identified people, and now we're just starting to pay attention to these questions. And when we think about DSO, Developmental Service Ontario, it's not a cure-all here, but imagine imagine a situation where they have something called passport funding that goes up to $35,000 a year on top of your ODSP. So imagine now for the first time we could apply for extra funding and supports. And if we work with the City of Toronto, the governments, we can actually have a pool of resources to help people out of poverty and out of homelessness. So that presented us as an opportunity. We applied for a grant in 2015, thank you, that looked at the question of developmental disability in shelter. We got $1 million to look at the question. Some key highlights. So we had to think quick, and we developed a system for diagnosis, because I'm the only psychologist in this system, and there's thousands of homeless people in the city. We developed a triage system that's evidence-based, and now people, instead of waiting 2 to 5 years for the diagnosis, can wait up to about 5 or 6 days. So we managed to change that around completely, so people with developmental disabilities in shelters now have access to these resources in days instead of years. The other key figure is when we did a survey, we triaged with 1,200 people in the city who were homeless. The figure was another staggering one. First of all, when I talked about my blip in my system, that was 6% of the population came up in my clinic. We weren't looking for people with developmental disabilities, came up in our system. But when you actually start reaching out and educating the staff and clinicians about developmental disabilities, the incident rate jumped. And now suspected rates of intellectual disability in the shelter system is up to 27%. And this is youth shelters, women's shelters, men's shelters. So now we went from something that's non-existent in the system to actually a big chunk of the population that fell through the cracks. And what do we do about that? And this is the question we develop, so we're clinical tools to get at that. And the next step for us, and now we've also looked at the question of housing in a shelter system. And that's my last point I'm going to do today before my recommendation to Canada, is the good thing about what we've done out of 1,200 individuals we assessed through this program, 20% could actually be housed independently without supports, meaning that it's an issue of poverty alone. But almost 50% required case management support, telling us there's some probably addiction or mental health issue that that affects their functioning and they need supports. The troubling piece that we found is that 36% required 24-hour supports in the shelter system, meaning that they have neurological issues or conditions that really prevent them from living independently in the community. And a subgroup, about 8%, require housing that simply does not exist in Ontario currently. And that's why we have folks living at CAMH for 20 years, folks living in shelter systems for 27 years. And we have to start thinking outside the box about providing care, but also housing to these individuals. So ending homelessness, and that's my message to Canada, and I think that's the reason why we're here today, is ending homelessness really requires all 3 levels of government. So we've talked about federal government a lot today, but it requires provincial and municipal governments as well. And it requires investments in poverty reduction, but also housing and health and mental health supports and social programs. A person with developmental disabilities, and now as well in the process, we're also looking at folks with dementia, so we have an aging population. They're overrepresented in shelters as well in brain injury. So these 3 populations as a cluster represent over 50% of the population in shelter system right now. What do we do about that? What do we do about our aging population? Anecdote, we had one guy who was actually in Ottawa. He was a senior diplomat working with Brian Mulroney. He ended up being homeless because of a neurological degenerative condition. And that was shocking to us because we think of homelessness, people that, you drink, you're an alcoholic and you lose everything. But sometimes it's the issue of why you become homeless is totally different. It could be something neurodevelopmental. This grade 8 student when in the 60s who had a traumatic brain injury, father hit her so hard that she fell over the piers, had a traumatic brain injury, went to hospital for 3 weeks, failed grade 8 6 times, and then at the age of 16 left school altogether and kind of went in and out of homelessness. So we here in this case it was a traumatic brain injury in this young woman's life, and this young girl at the time who changed her life trajectory. But there was no social infrastructure to help her along, to help her reach her maximum potential. So these are all things that come up right now in our program, and my message, our mistakes of the past should not penalize our most vulnerable populations. Today, significant investments are needed to ensure that future generations of Canadians live in dignity and with a roof over their head. So I probably went over my 1 minute, but thank you so much.